Glycine is known to enhance sleep quality, memory, reduce symptoms of obsessive-compulsive disorder, and improve schizophrenia. Glycine is a conditionally essential amino acid and neurotransmitter. The simplest of all amino acids, glycine plays a role in the synthesis of nucleic acids, glutathione, RNA, DNA, and creatine. Glycine is synthesized in your body from threonine, choline, and serine. Glycine is considered a conditionally essential amino acid because your body can't produce enough of it on its own, so the remainder must be obtained from foods like meat, fish, dairy, legumes, or supplements. Glycine plays a critical role as a neurotransmitter because it controls your intake of food, behavior, and complete body homeostasis. It can be both excitatory and inhibitory, which means it can stimulate your brain and nervous system as well as quieten it. Supplementing with glycine has been shown to be effective in treating metabolic disorders, inflammatory disease, obesity, cancer, and diabetes. Glycine helps you fall asleep more quickly, reduces insomnia, improves sleep quality, and promotes deeper and more restful sleep. Glycine has been shown to be effective in those dealing with schizophrenia, obsessive-compulsive disorder, and depression. Patients who've suffered ischemic stroke, brain ischemia, or cerebral ischemia are given glycine orally to help to limit the damage to the brain within the first 6 hours of the stroke. Glycine is one of the most important amino acids in your body. It helps in the regulation of cardiovascular, cognitive, and metabolic health. Glycine was discovered in 1829 by a French chemist after boiling gelatine with sulfuric acid, and since then it's been manufactured and distributed commercially as a sweetener and as a buffering agent for antacids. Glycine is a sweet, colorless crystal that's synthesized in your body from choline, threonine, and serine. As a therapeutic and nootropic supplement, it provides multiple benefits to human health. It's been shown to be effective for improving skin elasticity, and collagen peptide, which is loaded with glycine, helps to suppress sun-induced skin damage and reduce wrinkles around the eyes. Glycine supplementation helps to reduce the symptoms of schizophrenia. It helps reduce symptoms of obsessive-compulsive disorder, and low blood levels of glycine have been associated with depression. Numerous studies have also shown glycine's potential in improving sleep, enhancing memory, and increasing insulin sensitivity. Glycine modulates inhibitory neurotransmitters via glycine receptors throughout the central nervous system, and it potentiates the NMDA receptors, which provide an excitatory response, affecting cognition, mood, immune function, and sleep. Glycine boosts the brain health and the function in several ways. Numerous studies have shown that glycine influences the quality of sleep, reduces insomnia, and promotes restful sleep. It does this in a couple of ways. Glycine has a particular affinity for the NMDA receptor and the glycine receptors. This results in increased peripheral blood flow and a subsequent drop in the core body temperature. In other words, glycine works to improve blood flow in the body's extremities, which in turn reduces the core body temperature. The decrease in body temperature plays an important part of sleep induction, since the onset of sleep is associated with lowered body temperature, which then progresses to a deep sleep. Researchers have demonstrated this in animal studies, showing how glycine triggered a drop in the body temperature, which then helped the study subjects fall asleep more quickly and spend more time in REM, or rapid eye movement, sleep cycle. The study also showed that glycine can help you experience deep, slow-wave sleep more quickly. Glycine has also been shown to increase the production of serotonin in the brain, and this helps sleep because serotonin aids in the synthesis of the sleep hormone melatonin. Studies also suggest that glycine can help you get back to a regular sleep cycle after a period of disrupted sleep. Glycine has shown promising results in reducing the symptoms of depression, obsessive-compulsive disorder, anxiety, and bipolar disorder. However, its most pronounced efficiency is seen in the reduction of schizophrenia symptoms. Post-mortem evaluations of the brain of people with schizophrenia have shown fewer NMDA receptors when compared to those who don't have the disease. Researchers also found decreased levels of glycine in both the blood and the cerebrospinal fluid of people with schizophrenia. Glycine is known to be an NMDA agonist. It's well tolerated by the patient in both short and long-term treatment. To date, numerous studies have been conducted to evaluate the efficacy of glycine in treating schizophrenia. The first controlled trial used glycine doses of 15 grams per day, and this showed significant improvement during the glycine treatment. Another study of 21 schizophrenic patients were given high doses of glycine in addition to antipsychotic treatment. A significant 34% reduction in negative symptoms was observed during the glycine treatment, and the study's author noted that the improvements persisted even after the patients stopped supplementing with the glycine. Sleep deprivation, or the inability to get a good night's sleep, is an increasing concern worldwide. Not enough sleep or poor sleep quality can result in memory loss, poor metabolism, irritability, high blood sugar levels. The risk of heart disease increases. There's an inability to concentrate, weight gain, high blood pressure, and low sex drive. Glycine as a nootropic supplement helps the body to make serotonin, and this improves sleep and mood, and it influences key receptors in the brain, resulting in better learning and memory. Low glycine level in the body is linked to depression. Glycine activates the NMDA receptor in the brain, and it restores serotonin levels, which help to improve sleep and the ability to fall asleep faster. In one study, 15 adult females were given either placebo or 3 grams of glycine before bed. The study concluded that supplementing with the glycine showed a significant improvement in reduced fatigue, liveliness, and clear-headedness the next morning. Glycine helps brain cell signaling, and this boosts cognition, memory, and mood. Glycine, taken in high doses, has proven to be highly effective in reducing the symptoms of schizophrenia. It helps with depression and mental fluency associated with the schizophrenia, and it may improve psychotic symptoms also. Evidence also suggests that glycine assists with depression and neurodegenerative diseases like Alzheimer's and Huntington's disease. Glycine also showed a protective effect against neurological damage that's associated with a stroke, and research suggests improvements in memory, recall, and a sustained attention in those who are supplementing with the glycine as a nootropic. People who take high-quality glycine supplements report better sleep quality and improved mood during the day. Some users say they feel more balanced and livelier once they start supplementing with the glycine. Glycine is best taken 1 hour before bed. Most users report a minimum of 7 hours of undisturbed, high-quality sleep. Unlike most sleep inducers, glycine doesn't leave you feeling groggy or fatigued in the morning. On the contrary, users wake up feeling rested and ready to tackle the day. Glycine is a good joint health supplement because it aids in cartilage regeneration by enhancing collagen resynthesis. Glycine may also provide relief from night sweats for premenopausal and postmenopausal women. 22 schizophrenic patients who were treatment-resistant took part in a double-blind, placebo-controlled study. They were administered 0.8 grams per kg of body weight per day of glycine, along with their antipsychotic medicine. The clinical assessment was performed twice a week. The group who was administered the glycine showed a 24 to 46% reduction in the negative symptoms. In another double-blind, placebo-controlled study, 14 medicated patients with chronic schizophrenia were treated with glycine. The results showed a significant improvement in negative symptoms in the group that was given the glycine, but not in the group given the placebo. In a randomized placebo-controlled trial, 11 healthy adults were given either 3 grams of glycine or placebo 1 hour before bed for 2 days. The results indicated quicker sleep onset, followed by long, restful sleep. In 2012, another placebo-controlled study recruited healthy adults who were restricted to 25% less sleep than normal. The study subjects were given either a placebo or 3 grams of glycine before bed. In subjects who were given the glycine, the data showed a significant reduction in fatigue, often related to the reduced sleep. Scientists studied the effects of bioglycine, a biologically active form of glycine, in healthy students and middle-aged men. The researchers specifically measured attention, memory, and mood using a double-blind, randomized design. The results indicated that the bioglycine significantly improved episodic memory in both the young and the middle-aged group, and the middle-aged group also showed a significant improvement in sustained attention tasks. Recommended doses of glycine are 3 grams per day. Some recommend a glycine dose of 0.4 grams per kg of body weight twice a day when taking an atypical antipsychotic alongside it, like Zyprexa or risperidol. Many human trials have safely used glycine at doses of 1,000 milligrams per day for supporting brain health after a stroke, and up to 50 grams per day for schizophrenia. Most glycine supplements come in 1,000 milligram capsules. The most effective dose reported to be 3 grams 60 minutes before bed. Glycine supplements are generally considered non-toxic and safe, with few side effects in most people. However, supplementing with 9 grams or more of glycine could result in mild gastrointestinal symptoms like an upset stomach, nausea, loose stools, or vomiting. Slight sedation is also a possible side effect from taking a high dose of glycine. You shouldn't take glycine if you're on an antipsychotic drug. Unlike other drugs used to treat schizophrenia, glycine appears to decrease the effectiveness of clozaril, the antipsychotic, in some people. Don't use glycine if you're suffering from diarrhea, as it could worsen this condition. Due to the lack of sufficient research, glycine should be avoided by breastfeeding and pregnant women unless prescribed by a physician. Your body makes some glycine during the day, but you need more glycine than your body can produce on its own, so you must get it from food or a supplement. Glycine is particularly effective in those dealing with sleep disorders or insomnia. Supplementing with glycine should provide a good night's sleep and have you feeling well rested the next morning. Glycine has been shown to be effective in those dealing with schizophrenia, even when combined with most of the regular medications used for this disorder. If you're dealing with schizophrenia, you should also check with your doctor before using this supplement though. Glycine for the brain, used at the recommended doses, is non-toxic and safe for most people with little or no side effects. 3 grams of glycine seems to be the most effective for most people taken 1 hour before bed.